So, good afternoon. My name is Jeroen Kooman. I'm working at the Maastricht University Medical Center as a nephrologist in the Netherlands. And I'll discuss with you some potential application of wearable devices in patients with kidney disease. And if we look at a patient with kidney disease, they can have a lot of problems at the different organ systems, and even also can become frail and malnourished, have problems with their heart, blood pressure. What we actually would like to do is to detect problems and really structural problems in the different organs of the patients before they actually arise. And for this, potentially wearable sensors could be of use. And an example of this is actually not based on wearable sensors. It's based on pre-dialytic systolic blood pressure. And this is a paper from Van Oesviat. And what it shows is actually that before hospitalization and eventually death in patients, silently actually but very gradually pre-dialytic systolic blood pressure declined. So, and systolic blood pressure is actually a relatively rough measurement, but you can even see that these trends can yield important clinical information. What we also know is that dialysis patients dialysis treatment itself can have an important effect on organ perfusion. And these are studies from the group of Chris McIntyre, in which show that during dialysis, even when patients do not have any complaints at all, changes in organ perfusion at the upper part of the heart, at the lower part, for instance, the kidney, can arise. But we do not detect these changes because we cannot perform these, let's say, more complicated measurements during routine dialysis measurements. Interestingly, if we, for instance, look at patients who have central venous catheters, we can measure changes in central venous oxygen saturation. And this is a paper from the group of Renal Research Institute, which actually showed that central venous oxygen saturation as a marker of upper body blood flow can decline during dialysis sessions, and that the larger the decline, which parallels changes in decline in organ perfusion, actually could predict outcome and mortality. But again, if we do not measure this, this becomes completely undetected. So we have a clinical scenario of our patients on dialysis who have high morbidity and mortality. This even also holds true for patients with less severe stages of CKD. They have multi-organ impairment, an increased risk of sudden cardiac death, a lot of silent pathology, changes in organ perfusion, which we cannot detect during dialysis sessions. And next to that, they also have can have a phenotype of low physical activity. And whereas we often encounter patients, especially if they are treated with dialysis, if we encounter them frequently, we have a lack of information in the home environment. But we also know that a change in physiological signals, which mostly actually occur, of course, when patients are outside of the hospital, they can predict outcome. And you see now that at present day, there are many physiological variables which can be measured relatively easily by wearable devices. But it also has to be stressed that most of these devices actually were made for the consumer market. And obviously, if we are going to implement them in routine clinical practice, they have to be validated in our own patient population. But I'll give you some examples. And the first example is, for instance, dysrhythmias. And how could we detect arrhythmias by means of wearable devices? Now, it is even actually possible with present-day smartwatches. How a smartwatch, even a commercially available smartwatch, measures pulse rate is by the means of photoplethysmography. So changes in the volume of the wrist evoked by the pulse pressure leads to changes in light reflection, and you can detect this, and this gives an indication of the pulse rate. But there's also a possibility for some smartwatches actually by making a closed loop, a closed connection to perform a simple single lead electrocardiogram. And this might be of importance because many patients on dialysis actually experience arrhythmias, and these can also be silent. And you can see here that many of these arrhythmias actually arise during the dialysis treatment itself, but also, for instance, if you see at the right part of the slide, also during the end of the interdialytic session. And also these can be quite relevant, but also become undetected. And you see, for instance, an example of atrial fibrillation, in which you see that atrial fibrillation actually often occurs during a dialysis session, but even then we do not measure heart rate or electrocardiography on a continuous basis in our patients on dialysis. So it's actually only that you detect it if patients experience complaints, or for instance, when the nurse measures an abnormal heart rate. But for instance, with wearables, you could detect these heart rate abnormalities easier. And this is an example of the application of a smartwatch in the general population. This smartwatch was designed to identify atrial fibrillation by a dedicated algorithm, and mostly of these subjects actually which contributed to the study were relatively young and healthy. So you see also that the yield in itself of atrial fibrillation was not that high. But this changed actually when you looked at patients who are a little bit older, as you can see in the right part of the slide, that let's say even in this relatively healthy population, 3 to 4% had undetected atrial fibrillation by means of a smartwatch. And this can actually also be detected, although it's not primarily validated for this. This is, for instance, an example of a Fitbit device, in which in patients in rest, actually tachycardia is detected, and this later out turned to be an atrial flutter. So tachycardias would be relatively easy to detect. But what we also know is that many dialysis patients actually suffer from conduction disorders, and this might be even more important for their final outcome, because a lot of episodes of sudden cardiac death are preceded by conduction disorders. And you see here, for instance, an example of a conduction disorder in a patient who has an implantable loop recording. Now, could you also detect this with, let's say, present-day smartwatches? Yeah, not basically, technically it would be possible, but present-day smartwatches who are able to measure electrocardiography only do this so at a discontinuous basis. Really, the patient has to do this in an active way. So probably we'll have to wait for second-generation wearable devices, which can be worn continuously and non-obtrusively to really see if we can detect in a non-invasive way also these important bradycardias and conduction disorders. Will this also improve outcome? We don't know really yet. We know we have some examples of patients in chronic heart failure where, for instance, you have implantable monitoring devices. And actually most of the studies which were performed on these subjects actually showed an improvement in outcome. But we don't know if this is the same for patients on dialysis. Really, studies have to be designed to in the future to see if this is the case. And we also do not have always success. For instance, this is a trial in patients, not really patients, let's say in the general population, and at least patients who are not uremic patients were not included. But what it showed is that the detection of atrial fibrillation by means of wearable devices actually led to an increase in procedures, but actually not a reduction in, for instance, emergency department visits. So actually detecting a change in the physiological variable is not always leading to an improved outcomes. But obviously we would have to study this. I'll now move to physical activity. And what we know is that in patients with chronic kidney disease, and especially patients treated with dialysis techniques, physical activity is quite low. And what you can see in the left part of this slide is that there was actually a group of our own patients. If we gave them activity trackers, we saw that the physical activity, both in CKD5 patients who were not yet on dialysis, these are actually the middle part of the of this graph here, they actually had the same low physical activity as patients who were already treated with dialysis. And another study showed actually that low physical activity was related to an increase in mortality rate. And if we, you can also with activity trackers, apart from the number of steps, also look at the real sedentary behavior. And if you then look at our patient population, who are here to the left part of the slide, you see that they are very highly sedentary, much more, for instance, than patients with chronic heart failure or to healthy controls. And the same was true for the walking estimates, which you can see here. These are again the renal patients with chronic heart failure, actually compared to healthy controls. And then again, of course, we can detect low physical activity, and this is relatively easy. But the question is, does it really improve physical activity if the patient is aware of the fact that he or she is sedentary? And does it give a stimulation? And there are no data yet in patients on dialysis or in CKD patients. But what you can see here in this slide, that if in a meta-analysis in patients persons who are healthy, that actually wearable trackers in the intermediate and short time are able to improve their physical activity. But we don't really have long-term data on this, and certainly not in the patients on dialysis on the CKD population. What's an interesting application, this was done by the Renal Research Institute, is for instance to see what external circumstances can do on physical activity. And for instance, what you can see here is that this was after the introduction of the lockdown because of COVID in New York. You see here that there's the patients who wore a Fitbit, was part of an ongoing study, actually their change in daily activity rate declined by approximately 20% after the lockdown. And giving that, moving on a little bit to COVID, and this is an example of patients who were they were not renal patients, but this is actually a study which showed that by an integrated assessment of multiple physiological variables by means of different types of trackers, actually the risk of COVID could be predicted. And of course, this does not circumvent the use of early testing, certainly not, but it could identify in a way patients who are more prone to having an infection. It could lead to, for instance, to early detection. And this is also what you can see here is actually that a combination of different variables, changes in heart rate, physical activity and respiration actually had quite a high predictive value for diagnosing COVID, which was later confirmed by tests. And actually also what you can see here is that probably even more importantly, and looking at all these integrated variables and letting the system allow to make a prediction model actually led to quite a let's say impressive prediction of clinical deterioration, which actually, so this really shows the power of combining multiple physiological variables in predicting outcome. So in the future, if we really want to make use of these new technologies, probably the best way to use it is that to integrate their information in what we can call a so-called personal area network. But obviously, both patients and healthcare providers have to be helped by, for instance, artificial intelligence to make a logical, to take the logical information out of this very large amount of data actually, which is gathered, especially if you look at continuous non-invasive monitoring devices. So how could this look in the future? You have a patient, and actually what is measured here, trained in the use of technology. This also, yeah, that's a little bit of a caveat if this really would be the case, because it would leave out many patients who are not actually trained or cannot be trained in the use of technology. So I'm not really sure whether this it really should be a prerequisite, because it really would limit the amount of patients for which these devices could be helpful. But anyway, and let's say the information actually is integrated and transferred then to a clinician or let's say a wearable, an outpatient clinic actually specialized in information from wearable devices, and then it's decided whether action can or should be taken. But this is, let's say, kind of an ideal situation in which we both have availability of validated devices who are completely non-obtrusive, and in the case of patients who would be willing actually to be exposed to, be monitored all of the time. So how could sensors and personal area networks improve healthcare? It could theoretically increase patient participation and lead to an improvement in shared decision making, could improve personalized care, and it would have the advantage, certainly if it's surrounded by smart decision systems, by integration of multiple physiological signals, leading to early detection of clinical deterioration and followed by action. But of course, we have many challenges. It has to be accepted by the patients. They also have to accept, as already mentioned, even if it's non-obtrusive, to be monitored all of the time. I'm not sure that whether all of the patients would really want this. I'm not sure whether digital literacy is really needed or should be needed, because this would really limit the application of wearable devices, which I don't think should be the case. It should be either for all. It should be applicable, I think, for all patients, in order to prevent the division between patients themselves. There's a challenge of the use of unvalidated technology. So we should really use technology which is validated in our patient population. We should be aware of data overload. We really need smart support systems to help us and the patient. It could lead to medicalization, patients being monitored in an environment where they are normally free of medical interventions, which is also important. Importantly, of course, there could also be a lot of findings with unclear consequences, and we should be aware of accountability and regulatory and ethical issues. So what are future needs? Actually, that devices which could potentially be relevant and helpful are specifically validated in patients with kidney disease. We would need advanced analytical tools for interpretation of complex physiological variables. We should have clear user interfaces for patients and for healthcare providers. And we should start observational studies and intervention trials to show their potential benefit. And of course, from the beginning on, have a lot of awareness for regulatory and ethical issues. With this, I would like to close my presentation and thank you very much for your attention.